I thank the gentlelady and appreciate the opportunity to come here. And my friend from Ohio, we've been through this routine before. We were in the state Senate many years ago together, except I was arguing against his proposals and he was passing them. And this time he's arguing against ours and we're going to pass ours. And the issue really here, and I think the gentlelady from California brought it up, our friends on the other side, Madam Speaker, like to say, well, seniors are against it, but then AARP endorses it. Our friends on the other side say doctors are against it, but the American Medical Association endorses it. You say that this is pro-abortion, and you have 59,000 Catholic nuns from across the country endorsing this bill, 600 Catholic hospitals, 1,400 Catholic nursing homes endorsing this bill. So you're not calling anybody over here pro-abortion, you're calling 59,000 Catholic nuns pro-abortion, which I think really brings this debate to a head. We are doing something that we've not been able to do in this country for 100 years. We all go back to our districts, and with this bill alone, we're going to make sure, I know in my congressional district, that over 9,000 people can go back on the rolls because they've been denied because of a pre-existing condition. We had 1,700 families in my congressional district last year go bankrupt. And I know this is difficult, and nobody on this side is saying that this hasn't been a difficult process. It has been. But nothing good happens without it being a little bit difficult and challenging. And that's the point we are at now in our country. We cannot get to the point where we are afraid to do bold things in our country. We have to do this. We have to do this. Small businesses all over our state, to the gentleman from Ohio, all over our state can't get enough money to reinvest back into the capital, the technology, the wages that we need in order to get our businesses jump-started because it keeps going over to health care. And this is, if you're a small business, you're going to get a tax credit up to 50% of your health care costs. This is a tax cut for small businesses. And we're going to make sure that people are healthier and more productive. And I know our friends on the other side want to say, well, let's start over. Let's get the blank piece of paper out and let's start all over. Let the insurance industry start all over. Let them go back to 1993 and 94, revoke all of their increases that they gave to the American people over the last 15 or 20 years. Let them start over. Put all the people who have been denied because of a pre-existing condition back on the insurance rolls. All the people who got sick while they had insurance and were kicked off their insurance, put them back on, and then maybe we'll consider starting all over. But we've got to make this bold move to make sure that everybody's in the tent. This is a moral issue on so many levels. We can't keep telling citizens of the wealthiest country that this globe has ever seen that we have the ability to care for you, but we can't afford it. It's time to pass this bill. We're going to do it this weekend, and we're going to look back just like on Medicaid, Medicare, Social Security, and civil rights. We did the right thing, the moral thing. The other side, Madam Speaker, the other side was told by their consultants not to support this bill. And as for the Medicare costs, why are we going to save $500 billion? Because there is waste in the Medicare program, and this is something that they've proposed on the other side for a long, long time. In addition to that, if those people 55 to 60 up in the Medicare, before they go into Medicare, actually have health insurance, they're going to cost less when they get into the Medicare program because they're not going to be as sick. When you come from an old industrial area like ours, there are sick people that have lost their job, don't have health insurance. They wait until they get into Medicare, and they are chronically ill, and they cost more money. That's how we're going to save money.